Thank you, Emily. Coastal Kids Dentistry makes going to the dentist fun and easy. Now, it's a one-stop shop for both dental and orthodontic care for the kids. We welcome orthodontist Dr. Desmond Chapman and Dr. Jeff Marilise with more information. Hi, guys.
Good morning.
Good
Thanks
to
for
have
having
you.
us.
We were just talking during the break quickly. I'm going to let you answer this question, but it's shocking to me. How early do kids need to see an orthodontist now? What do you recommend?
Well, typically we like to see kids at about age 7.
Wow.
That's kind of a recommendation from the American Association of Orthodontists. What happens at age 7 is the permanent anterior teeth start to erupt, and it's kind of a great age to just do that initial check and see if there's any issues. We screen for a couple issues at that age, and they're pretty easy to fix if we catch them early.
Okay, so obviously catching it sooner rather than later.
Yes,
I remember when I was a kid, we were teenagers. Like, this is a whole shift in orthodontics overall.
Well, actually, we check everyone at about age 7, but only about 15 to 20% of kids will actually need treatment at that age.
Oh, wow.
So they'll come in, we do a check if they don't need it. Exactly.
Makes my wallet feel better.
Exactly. So middle school, we love to do it all in one stage at middle school if we can, but every once in a while there's that need for an early phase, and when we do that when necessary.
So what are some of the warning signs? You're brushing your kids' teeth. Like, what should we be looking for that we might need to see you?
So basically severe crowding, you want to look at that, or severe spacing, or if the upper teeth are sticking out over the lower teeth too much, or the lower teeth are sticking out over the upper teeth too much. Yeah, or if the upper jaw is a little too small. And then any sort of habit, so if there's a finger habit or a thumb habit. But basically, if a parent has a concern, we just want them to come on in and let us talk about it and answer any questions that they have.
So that leads me to what happens at this first orthodontic visit. What do you guys do?
It's an easy appointment. We like to try and make it as fun as we can for the kids. So we usually try to get to know them, ask them what they've been up to this summer, and then we just take a quick look and we see if there's any issues. If there is, we go over what the issue is and how we're going to fix it. And we actually have these you know, kids these days like YouTube and they like videos, so we have this computer software that'll show them exactly what their problem is and then how we're going to fix it. That really makes it neat. I think the kids really enjoy that.
So obviously the benefits of starting sooner rather than later, would that shorten the overall treatment time?
It basically does. Growth is very important with kids and with treatment with kids. So if we can utilize that growth and make their treatment, you know, smoother and more efficient, then by the time they need braces when they're older, then usually it's shorter and quicker and easier on them.
Okay, so let's say we get to the point where my child does need braces. How long does the treatment last now? Is there an average number of years? How many visits do they have to go?
Usually we'll try to see them about once every 4 to 6 weeks, where we'll change their colors, we'll switch their wires, and we'll kind of keep things moving forward. Overall treatment usually is about 1.5 to 2 years, and that's when it's done in middle school. If they need that early phase that we talked about, that's usually much shorter. We try to keep that at about 10 months.
Yeah, and I imagine since I had braces, you guys have come a long way. Do you still have the rubber bands? You do those?
We still do rubber bands.
The ones that like shoot across the room?
We do. And we have some fun neon colors for
We do,
those
we have some neat colors.
We do. And seeing you every 4 to 6 weeks, the kids become their friends.
Right.
And that's why I love you guys. It's so much fun, truly, to take your child at any age to the dentist.
Yeah. It's very bittersweet when we take braces off, because we're so happy for them because they have their beautiful smile, but sad for us because we don't see them now on a regular basis.
So I know back in the day there were a lot of things we couldn't eat. Is it still the same as far as like no food you can have during braces?
Oh, yeah, the dreaded no food list. So anything very crunchy or sticky you want to stay away from, because ultimately it breaks brackets and then it just keeps them in their braces for a longer time.
Okay, so again, come to the appointment on time, follow the no food list. That'll save you from trouble. Brush and floss regularly. Of course, coastalkidsdental.com for more information. And photo joyous day too when you get those off. You have that big smile. Do kids still wear retainers?
They do.
They do?
They do, just at night.
Just at night. Well, thank you guys so much for being here.
Thank you for having us.
Your locations, I know you're everywhere, but where can people find you?
Hanahan, Monk's Corner, West Ashley, Walterboro, and Dorchester.
All right, and the phone number on the screen, it's 818-5437 or kids, and again, coastalkidsdental.com. You guys take care of everything. You're truly fantastic. Such a pleasure. Thanks for being here. I'll see you in like 2 weeks. Well, not you. We will be there in 2 weeks. All right, we've got much more LowCountry Live in just a moment. Stick with us.